Good afternoon. Today we're going to be talking about enhancing cultural sensitivity. I'm looking at discussing implementing immersion training for healthcare providers serving LGBT individuals. Excuse me, a little introduction. In contemporary healthcare, ensuring cultural sensitivity and competency is extremely important to providing equitable and inclusive services. Among the LGBT community, there is often the facing of a unique challenge in accessing appropriate healthcare due to systemic discrimination, lack of understanding among healthcare providers. To address this issue, it's imperative to implement specialized training programs aimed at enhancing cultural sensitivity, specifically tailored for healthcare providers serving LGBT individuals. This policy proposal will be discussing the necessity and benefits of immersion training in order to improve cultural competence among healthcare professionals. A little background. Currently, the LGBT community encounters disparities in healthcare and mental health care access and quality due to various factors. Some of those include stigma, discrimination, and inadequate provider knowledge. Studies have consistently highlighted instances of discrimination and insensitivity experienced by LGBT individuals within the healthcare settings. This leads to avoidance of care, delayed treatment, poor health outcomes, in general, just poor health overall. Recognizing the healthcare organizations and policymakers have increasingly emphasized the importance of cultural competency training, but this area tends to be lacking. So, a little bit more background. There is a current public policy in place that does mandate cultural competence training to include the LGBT community. However, it is very basic. It's a computer program, it's basic vocabulary, a little bit of information that gets into detail, but it's not a true understanding of why. Why do we need a change in policy? Why do we need to work on discrimination? What happens if these people don't come for help? And also, it doesn't have people look inward to see, hey, why am I treating this individual differently? And to just take basic moments to think about it. So research that's been published in the JAMA Internal Medicine found that lesbian, gay, and bisexual individuals were less likely to have visited a healthcare provider in the past year compared to heterosexual individuals. This delay in seeking care led to undiagnosed health issues, worsened health outcomes, and the prognosis is even more poor for transgender individuals who tend to face even more stigma, even more discrimination. There are also mental health disparities. So the National Alliance on Mental Illness, which is also called NAMI, they report that LGBT individuals are at a much higher risk for mental health conditions like depression, anxiety, and substance abuse due to what's called minority stress. This exact thing I'm talking about, the discrimination, the stigma, receiving inadequate care just because of identifying on this spectrum of sexuality. The healthcare discrimination showed up in a study conducted by Lambda Legal, found that 56% of lesbian, gay, and bisexual individuals and 70% of transgender individuals reported experiencing discrimination from healthcare providers. This discrimination can manifest as refusal of care, using inappropriate language, denial of gender-affirming treatment, or even such things as jokes in the hall, or even within the clinics, people talking and making jokes when there actually might even be an LGBT individual among them and they're not realizing it. So a lot of microaggressions, a lot of joking hand in hand with also a basic refusal of care, citing things like religious differences or morals or values not being in alignment, rather than just looking at true good healthcare or mental health care. Excuse me. The National Center for Transgender Equality reports that transgender individuals face significant trouble in healthcare, including high rates of HIV infection, inadequate access to transgender-specific healthcare and services, especially gender-affirming care, and mistreatment by healthcare providers. In a survey, 33% of transgender individuals reported having at least one negative experience with a healthcare provider in the past year. That's 1 in 3 people. So no wonder they're not wanting to seek out care and they're getting sicker or not going in on time to get help. They know they're going to walk in and get mistreated. At least 1 out of 3 people. This includes a cancer screening. So a study published in the American Journal of Public Health found that lesbian and bisexual women are much less likely to receive cancer screenings including mammograms and pap tests compared to heterosexual women. Other research shows this includes trans individuals, and that can include trans males who still have their female parts that they were born with, that they have not had surgery to remove, or they're still even having periods. And the doctors are using the wrong language. They're being gender inappropriate. They're not speaking with the correct terminology. They're not being sensitive. They're not using inclusive care. The disparities put them at a higher risk for late-stage cancer diagnoses, poor outcomes in general. So all of this to say that people who are just living their lives and just happen to be in what we consider a marginalized community feel they can't safely go to a doctor. It comes to safety. They don't feel safe. They don't feel secure. They're going to walk in the doctor's office and they're going to feel made fun of, discriminated against, stigmatized. So the policy proposal that I've written involves the implementation of the immersion training programs for healthcare providers. This type of program represents a more proactive approach to addressing healthcare needs of LGBT individuals. Immersion training involves comprehensive, immersive learning experiences designed to deepen understanding and empathy towards specific cultural groups. This type of training would expose healthcare professionals to the actual lived experience, the real challenges, the unique healthcare aspects and needs for LGBT individuals. There's different ways to do it. There's virtual reality, much like a video game. There's interaction, having an actual training where everybody plays a part. And we'll get into some of this later. Some of the key components of the immersion training would include the basic cultural competency education. Some of this does already exist, but this will be in a more conversational form rather than computer-based. The computer-based that exists right now, you listen to a bunch of information, you learn some vocabulary, you've answered a pre-test, you answer a post-test, and then you've proven you are culturally competent because you retain the information for 5 minutes. There's not a lot of critical thinking involved. With immersion training, it's much more holistic. It looks at the whole picture and it makes you experience what's happening. Providers would gain insights into those experiences through learning more about providing affirming, inclusive care. That can look like the role playing or the simulation. So, having interactive training would allow healthcare providers to practice communication skills, practice navigating sensitive topics effectively. Rather than just learning basic trivia about how to handle these situations, they would actually role play and have examples and little vignettes that they would participate in. These exercises would help providers develop empathy, cultural sensitivity, and real-world healthcare situations with their peers, with their colleagues and coworkers. This type of training, once it gets out there that it's happening and people see more change, they're going to be really excited. The community is going to be engaged in this. They're going to be the LGBT community. They're going to be promoting it and explaining it and showing, hey, look, healthcare is changing. We can feel safe again. We can go to the doctor and we're going to know we're going to be treated correctly and with sensitivity, not with stigma. Healthcare providers, they have the opportunity to engage directly with community members in kind of some think tank situations ahead of time to figure out exactly how each community specifically would want to approach their trainings. So hopefully some collaboration would happen within the medical community and, like for my example where I live, it's called The Source. It's an LGBT support that's in place. So collaboration with them would need to take place to properly commit this training. Excuse me. The improved patient-provider communication is top of the list. Everything I read and showed during my research before putting this policy together was that the enhanced cultural sensitivity facilitates open and respectful communication between healthcare providers and LGBT patients by practice and by having their eyes open to what those experiences are all about. That's going to reduce the healthcare disparities and improve overall patient satisfaction, which means they're going to come back for more health care and more mental health care, which is going to benefit not just that individual, but all kinds of other areas. That includes state-funded health care. Now, since this is going to be a policy that's only going to be starting in California, not a federal policy, the hope is to do continued research and to show, hey, immersion therapy really does make a bigger impact. Hey, let's start looking at working in the federal level. And we're going to see a lot of differences come up with healthcare and with how we approach these specific populations in mental health and healthcare. This is going to improve the public perception of healthcare overall as well. The LGBT patients, the broader community, enhancing the reputation of the clinics that do show that they can improve on their cultural sensitivity. So, the public policy that I am proposing involving the immersion training is going to represent a crucial step towards enhancing cultural sensitivity among healthcare providers serving these individuals at the state level. And then the hope is exponential growth, that everyone's going to see, hey, this is really working. We're seeing huge improvements. We're seeing cost savings because they're not waiting until things are much worse. Less medications, less surgeries are going to be required. Because as we know, those pre-screenings really keep people from getting extremely sick. So keeping general costs down, including with mental health as well. Community mental health is full of people that come in talking about, hey, I didn't feel like I could go to the doctor when I first started feeling this depression. And now here I am severely depressed. I can't get out of bed. Because maybe they were afraid to come and talk about, their depression because they didn't want to be stigmatized. By equipping providers with the knowledge, skills, empathy needed to deliver the affirming and inclusive care, we're going to be working towards eliminating the disparities in healthcare, promoting the health and well-being of all individuals, regardless of how they identify. Implementing immersion training, if we can show that it works with one population, then why not have a training for all the populations that are considered marginalized? So this really could be the beginning building block of some significant changes in the healthcare industry. Thank you so much for your time and listening about the subject that I am truly passionate about. I hope that you consider learning further about why immersion training is the way to go. Thanks.